George Kilpatrick, inspiration for the nation, celebrating people we feel good about. Well, this topic I'm really excited about because I get to learn a lot about a topic that I really care about, and that is maternal health, particularly of Black women. We're going to learn about Village Birth International. They received a $50,000 grant from the Black Equity and Excellence Fund from the Central New York Community Foundation, and they basically hire Black doulas to work with women in our community. Why do they work with Black women in our community? How do they work with Black women in our community? What exactly is a doula, if you don't know, and how do they do that? Why did they decide that they were going to do this? All of those questions we hope we remember to ask them later on when we find out our guests. Joining me now, Sequoia Kemp and Asteir. They are co-founders of Village Birth International. Sequoia, tell me how you got started with this.
Okay, so first I wanted to clarify. So I am a VBI doula. So I was trained and certified through Village Birth International. And over the past 7 years, it has grown into this collective with Asteir and Marcel, who is here. And so through this, we have formed Sankofa Reproductive Health and Healing Center.
Okay, all right.
Yeah. So I am a proud VBI doula. I was trained and certified by Asteir and M.A. Brill of Village Birth International. About 7 years ago, I think I was going into my sophomore year of college. And since my certification, becoming a doula, I have always worked closely with Asteir to provide childbirth education to the community, to provide doula support to our community, and also to support and provide mentorship to the doulas who have come on after me. And so I'm very excited to now be in this place where we have a center of our own, and where we have the freedom to be able to be as Black, as radical, and as heart-centered as I learned how to be during that training.
All right, so let's remix. So the collective that you all represent here today is Sankofa Healing and Justice Center.
It's Sankofa Reproductive Health and Healing Center.
Okay.
So Village Birth International is the fiscal sponsor for Sankofa.
Okay.
So we've trained all the doulas, and the doula collective, Sankofa Doula Collective, has created this perinatal safe spot and named it Sankofa Reproductive Health and Healing Center.
Sankofa Reproductive Health and Healing Center. We got that now, right? So and so what we know that there are some reasons why you specifically focus on Black women and as you suggested to me, Indigenous women, women of African descent and Indigenous women. Explain what that means.
So we focus on women of African and Indigenous descent for various reasons. First of all, childbirth is a very personal time. We are all women of African descent. And when I say women of African descent or people who identify as Black, that term represents the full experience of our lived experience. So that could be a Black woman, a trans woman who identifies Black, gender non-conforming individuals, and people of African descent. So African Latinx people, African American people, African people who are born in the Caribbean, people who identify as Black, and also African immigrant, which is very important to us because we have a large population of refugees in our family in our community from the continent who also really need to be supported in childbirth. And one of the reasons why we're focused on maternal health care is we know that people who are identified as Black are 3 to 4, sometimes 5 to 6 more likely to die in childbirth or to have severe morbidity, which is illness or injury during this time. And a lot of that is avoidable. So we know that 60% of those outcomes can be avoided.
So when this collective came about, from what I understand in your background, there was a sort of an underground movement already happening in the community. Tell me more about that, both of you. Sequoia, I'll start with you.
Yeah, so like I said, since I got trained and certified with VBI, we had started out with the VBI collective, and through at that time we would plan different like doula info nights. We would plan like group prenatals. We would watch. We did screenings together, and then in 2018 and 2019. So I personally am the founder of Doula for a Queen. So their center is a partnership between Doula for a Queen, Village Birth International, and Zenji Yoga. So during the 2018, 2019, I was just like, I want to teach my community. I had just graduated from college. I'm like, I want to give back to this community that has like poured into me. And I wanted to do it in a way where it could be accessible. And so Asteir and I, she really gave me the push, and she was like, you know what, you don't need no one's permission, just do it. So we just started teaching childbirth education. We started at the West Side, the Peace Center, Peace Inc. on the West Side, and then we grew and started locally hosting like different informationals about like yoga and movement and pregnancy, about hypertension and health, about health justice and birth justice, and just connecting all of these intersecting issues that we see in our community to talk about how we must like fight for birth justice and reproductive justice. And so I think over the 2019, we were just like, I invited Marcel to be a part of our movement yoga class with the prenatal class. And after that, we just kind of blossomed into a collective when we started doing birth song workshops right out of Cafe Sankofa. So it was really where the co-op was transferring into the wellness and art center that it is now. And so I think it really does, you describe it. It did seem underground at the time because a lot of this time we did this without funding. A lot of it, the events that I had put on, we did the Black Healing Expo and in conjunction with VBI and Zenji Yoga. And we did it with just community support, community donations. And so a lot of it was just a lot of heart, a lot of blood, sweat, and tears. But we have a radical commitment to our community, especially those on the South Side, who face some of the highest disparities that we see in Syracuse.
So
Also, just like to say
yeah.
that the underground piece is really paying homage to all the Black women who are, you know, supporting other people in their families in birth work. So, you know, that is unpaid labor that has been going on since we have been here. You know, when a lot of people who come who want to be a doula, they are that auntie or that sister or that grandma who is just that person in the Black community who like shows up for the mom. She feeds the mom. She goes to the hospital with the mom. If you have a question about, you know, your 3-month-old baby, you call your aunt, you know, whoever, Aunt Sarah, to be like, you know, what's happening. And so we have always been doulas. We have always been birth workers. And so that underground thing is really what we're talking about. I moved up here in 2010 and started working as a community-based lactation educator. And I really, it just kind of revealed itself. I mean, it could have happened anywhere, but you just see women coming to the forefront who were like, I've been doing this my whole life. Like, you know, okay, I'll get certified, but I've been doing this since I was a kid. So that's really the underground piece that you're speaking about.
Tell me, a lot of questions here. Let me go with what I'm feeling right now. When you talk about reproductive justice, can you talk to me about what that means in this context, particularly for women of African descent and Indigenous women?
So reproductive justice means that a person who is reproducing or choosing to birth or not to birth has a right to have their baby in safe, dignified, holistic care that is self-determined. And if they choose not to have a baby, that is also their right. So it's actually really speaking to human rights in reproductive health care. And the justice is centered on the fact that we know that that is not happening. And so there needs to be a justice-oriented approach to reproductive health care.
A justice-oriented approach to reproductive health care. And I also wanted to just take a moment to pause and say, what is a doula? right? Because we're throwing it around like it's everybody's familiar with it. So let's just define that for the moment. We know what it is, but what is it really?
Yeah, so basically a doula is someone who is, so it's a non-medical support person. So we provide emotional support, provide during labor, we provide physical support, and we also provide education throughout the pregnancy. Many of us provide like preconception counseling. So we're just really helping people gather the information that they need to make informed decisions throughout their pregnancy, informed decisions during their labor and birth experience, and also providing that immediate care once they've gotten home, or stay, if they have a home birth, once they've settled in, providing those immediate care, newborn care, and again, connecting them to resources. So I say I'm just like your personal cheerleader, your personal coach, who is here to provide you with support, here to do research for you if you have non-medical questions, or you have an appointment with your provider and you're like, I talked about this, but I still don't understand it. We stand in the gaps to help make sure that people are being as educated and informed as they transition into parenthood. And through our program, we become full spectrum doula. So full spectrum, that means that we provide support and doula care to those who may choose to terminate, to those who experience miscarriage or pregnancy loss, and those who also are able to have full-term pregnancies, or pregnancies that they believe hope to carry on.
Yeah, we're talking with Asteir Bay and Sequoia Kemp. They are part of the Sankofa Reproductive Health and Healing Center. Now, I did ask you about Village Birth International, didn't I? And if I didn't, can you connect me to what that is, Asteir?
So Village Birth International is a international organization. We are a policy advocacy and training organization. So I work as a co-director with my partner, M.A. Brill, who lives in New Jersey. We've done a lot of policy around Medicaid reimbursement, hospital protocol, things like that, that really support birthing people. It started in Uganda with a midwife there who does a lot of community-based midwifery care. It started as a mobile midwifery clinic. And then we were able to go over there and partner with her and also do the same thing, just kind of basing it off of our African mentorship midwives and also Black granny midwives, who really have been the sole birth workers in our community. So a lot of our work pays homage to Black midwives and African midwives across the continent. And we do doula trainings in Syracuse specifically for our local community, but we also do a lot of policy work for federal and local legislation around maternal health care and reproductive justice.
So the collective now, Village Birth, D4Q, and Marcel, Dr. Marcel Haddix in the yoga, the healing piece. Talk to me about, before I go to that, I want to understand why, first of all, first thought that came to my head, can a man be a doula? Or is that like counterintuitive, right? So let's answer that first.
So yes, there are lots of male doulas all around the country.
Did not know that.
Yes, we. I think that doula care, just like traditional birth working care, is a very personal extension of yourself. So even Sequoia and I, as birth workers, our extension to our community is different based on our own personal who we are, what we have, the experiences of reproductive healthcare that we've experienced. So there are men who are doulas, and they come to doula work for various reasons. And doula work is not just about showing up at the birth. It's about education. It's about support. It's also about education for the family. So we actually need more male role models of African descent or identifying as Black to kind of show up in these reproductive spaces to protect Black mamas, but also to offer support to partners and spouses who also need to be protected and held and cared for.
I appreciate that because, and so in a couple, again, I'm just going to go with the thought that I have. So in couples, right, or partners, if you will, right, how does the partnership, how does the doula work with the partner of the person who is giving birth, and how does all of that work together? And is it not about the partner? Is it just about the woman who is giving birth, and that's our primary concern, and the partner then has to deal with that? If the partner is male, that has to deal with that as part of what his partner, assuming it's a him, needs at that particular time. So walk me through that little triangle thing.
Yeah, I mean, this is something that often comes up with me when I work with couples. And typically when I meet with my couples, I let them know, like, I'm not here to replace you. I'm here. I say, I'm y'all's doula. I'm here for your family, because oftentimes I tell my clients that the carrying person is always expected to go get all the information and then educate the partner. And so a lot of that comes with, self accountability and saying, hey, you all have hired me, so I'm going to push you to grow, and I'm going to push you to learn. I'm going to push you to be active, because your physical touch in labor, it can be more effective through the hormones, the oxytocin. So right out the bat, I try to set a foundation where the male part, if it is a male partner or partner, understands that we are a team, and that I'm here to, if I have questions or they have concerns or they have anxieties, that I am there as the doula to also meet those needs as well. But when we are in the birthing room, our primary focus is the birthing person, because they are going through the physiological changes. But there are moments where you pause and you check on the partner. Are you going to sleep? Are you getting water? So it really is about learning how to work with one another, so that you aren't taking up space, but creating space for this couple to have a beautiful experience. And most recently, a lot of my clients, my clients are saying that a lot of them was like, I wanted my partner to be more involved, but they didn't know how. And so with my moms who are having their second children, for them, it's like, it's a second chance at really bonding and really being a team as they go and encounter and transition into becoming parents of a second child. So in most cases, I just say I'm a team player. I'm here to answer questions, but I let them know that if you're not being helpful, I am going to step in to be supportive if that's what's necessary. But in most cases, I do try to make sure that the partners or the fathers feel comfortable enough to ask questions and to be an active participant in the birthing experience.
Yeah, and I'm noticing the language that you're using, birthing person, this language. I know that's intentional. Talk to me about that.
So that goes back to a little bit when you asked about people of African descent, and I was describing Black mamas. And so we have to think about all the ways that reproductive injustice is happening to our community. So we know that Black women who are identified as women, have higher rates of maternal death and illness. But we also know that Black folks, people who identify as Black and African descent, those people who are considered, who are trans, who are gender nonconforming, whose identity is very in that way, we also cannot deny that they are also experiencing reproductive harm. Mm-hmm. And so you can't be out here as a birth worker or even as a medical professional, period, who has a justice-oriented understanding of healthcare and deny those people the same kind of upliftment and sacred healing in this process as people who only identify as Black women. So we like to make sure that we are inclusive And so we use Black woman, Black birthing person, African descent, because we know people are identifying in all kind of ways. We want to make sure that a person who is identified by as a Black person in any form that they show up, they know that they can come to us and be cared for humanely and sacredly, and be protected, no matter who they say they are.
Yeah. And so how do people decide that they need you, or are you looking to provide support to people that don't even know that they could use you? So see how I flip that? They
I mean, I think that if you are a Black person in America, you know that you've experienced racism. You've experienced harm in your care. And so we don't have to convince people that they need us. We just have to make sure that people know that we're available. We don't, there's no, this is not a business model. We're not entrepreneurs. You know, most of us have been doing this and being severely underpaid. So, you know, we know that the need is there. And so that's why we're here. And, you know, we appreciate you having us on here, because I think even though we've been doing this work since, you know, it's been around, and, you know, VBI has been training doulas since 2012, people still are like, oh my gosh, I didn't know you existed. So I think that's also why this equity grant was so important. It was so important for the community, the funders, to acknowledge that birth work, first of all, is important. Both birth work for Black folks is important, and people need to be paid. Like, this work should be valued, and that is something that we have advocated, particularly in Village Birth International, that this work be paid for.
Go ahead, Sequoia.
I was just gonna add that the central piece is our healing, and I think that when moms have had you know, traumatic birthing experiences, or they have had experiences that they didn't know were traumatic until they learned that that's not how birth should be, right? That you should be, providers should be asking you for consent. You should be an active participant, collaborative. Though in those moments where they're like, oh well, I don't want to go through that again. Let me connect with a doula. Like, what do I have to do to improve this birthing experience? And so I think that when we talk about healing, I think that there is a huge shift in, especially like millennials, but also just intergenerationally, where we're just trying to reclaim who we are. We have this self-confidence, this and self-determination to say that we're not going to just keep having these experiences if we can do or say anything about it. And so I think that a lot of times when my clients come to me, they're excited just at a second chance or a third chance or a fourth chance to not have to carry on the generational trauma of birth, but get an opportunity to realize what it's like to birth in freedom, birth in confidence. And so I think that as women, and as we are seeing like more Black women become identified as womanists and feminists, we're seeing people saying, I need my sister, I need support, and I'm not afraid to ask for that. And I think that that's really been a very common theme in the people that we've come across these past couple of years.
Ain't no secret, you're both are activists, right? So let's just be clear about that, right? Y'all are straight up activists, because I'm listening to the language that you're talking about, the language that you use, birth in freedom. And there's this particular meaning to that. Tell me more.
So, I mean, Village Birth has a tagline that says that there's liberation in birth. And so that has been something that has really driven our advocacy and policy work. And I think that it is so important, particularly for our community here in Syracuse. You know, so many parents are parenting alone. So we can talk about birth, but what happens when you go home and you're by yourself, or you make decisions and you're judged for that decision, or you just don't have the tools to be a good parent right now? Like, we know that there's a lot of parents who don't have the tools that they need. And so, you know, on multiple levels, adults are suffering, but children are suffering. And so there is liberation in us coming together at these most sacred times and learning what it means, not only to educate ourselves and to hold each other, but to heal. And so that should start preconception. Like we're kind of starting even a little bit late then. But what does it mean for somebody to experience birth confidently without suffering, and to go home and to be cared for, and to start their journey as a parent in that way, versus to experience harm, to suffer, to be ill, to not have what they need, to not be fed properly, for people to be like, why are you doing that? What you doing that for?
Mm-hmm.
What kind of community would we create if we held each other in that way?
Mm-hmm.
And
Mm-hmm.
so we as adults could be better, and our children could be better, because that's what we're modeling for them. And so that's really liberation, to me. I mean, I know everybody has their own understanding, but that really is freedom. That's really liberation to me, to have a self-determined reproductive journey. Like you said, once people have that, it's like, I'm not going back to that. I'm sticking with this. And my children and my children going forward will also see that and will also make that choice.
Right. And as people who have been historically excluded from this ability to birth on our own terms, it is really important for us to know that it is possible for us. And so when we have people, a lot of my clients come to us and they're just like, I don't want to die. Like, they're like, I've seen all the articles, I've seen the documentaries, and I do not want to die. And
Right.
that is a real fear. And so we're like, birth does not have to be traumatic. It does not have to be like this. And we're trying to say that this is how it can be, and trying to, change the birth culture around what it can be like to be a Black person birthing in Syracuse, New York. But we also expand what, like Asteir said, a lot of people say, oh, healthy baby, healthy mom, that's all that matters. It's like, no, a healthy family. And then what does health mean? You could be physically healthy, but what is the mental state? Or do you have access to fresh food? Do you have transportation? Do you have the means to actually live a healthy life? These are the things that us as community doulas are concerned about. We're not just concerned about if you had a good birth, but we're concerned about, do you have the resources to sustain a healthy life for you and your children and the children to come?
For male identified individuals who want to join the movement in the community, same process for anyone as for everyone else?
Yes. And we welcome them. I mean, we need more Black fathers to stand up and be like, this should not be happening to our women. This should not be happening to our children. This is what we also believe, that there's liberation in birth. So, I welcome that. We welcome that. We're constantly expanding and growing and trying to make sure that we center people. Right now it's just Black women that we have, but we certainly want to expand in that direction.
And I don't want to miss what Sequoia said about I don't want to die, this idea of Black women in particular with lower birth rates, lack of prenatal care, and ongoing care and appointments and such and so forth, particularly in certain populations within the diaspora, right? Within certain demographics within our diaspora. So I understand the importance of that. And basically, we're trying to improve healthy outcomes. But I want to add one more piece to this, because we kind of hinted at it. And I want to just name it. You also sort of talked about the systemic oppression and historical oppression and racism, if you will, in conjunction with this work around reproductive justice and healing and reproductive health. So can you just name that and how that shows up and why your work is working to work against that?
Yeah, so we know that sorry to go away. We know that
both of y'all can have a piece of that.
We know that medical racism is affecting all of us. Everybody who's identified as Black in this country, we are all affected by medical racism, not just people who are birthing people. We also know that it doesn't matter if you're poor or not. We see those high profile cases of Serena Williams and Beyonce. I got good insurance. It's still the same. So it doesn't matter if you got Medicaid or if you got Excellus. So that's not really changing it. We know that racism and implicit bias affects our healthcare. We also see those outcomes, and we also know that you don't have to die to experience harm. So people are experiencing, they're suffering in their healthcare, childbirth. If you have diabetes, if you have heart disease, we are going into medical institutions that are not seeing and valuing us. And so I think that there, especially with COVID and all these things going on, there's been a lot of talk around, you know, how people need to be accountable, and, you know, what implicit bias trainings and anti-racist work and blah, blah, blah. But this is a personal thing that people need to be more reflective and think about how they're engaging. And if a grandma walks in, they need to think about, would I treat my grandma this way? If a sister walks in, they think about, would I treat my sister this way?
Right.
And so we know that's not happening to us. And we also have, there's a lot of talk around social determinants, and it really places the blame back on the community. So they don't have transportation, they don't have, it's really a structural barrier, not a social barrier. Like we didn't place these barriers in, we didn't do that. Like it's not our fault that we can't get from one place to the other, or there's not appropriate transportation for us to get to where we need to go. So I think the language is really important, and thinking about how this is a generational thing. And you can see that with so many things that are happening in Syracuse, the 81 Project, all these things, these are structural determinants that are outside of the community. And so it's important, because there's a lot of community-based organizations that are addressing this right now, and we're just one of them. So we're addressing reproductive justice. We're addressing birth from our own community. Like the health department, like we're not on that. This is something that is coming from us, from our own community. So it's a whole nother thing. So I think it's really important that people who are interested in helping and changing and also being actively anti-racist understand that communities need to be self-determined, and they need to speak to an existence what they need. They don't need to be told.
And I think the one thing I was going to add was the piece about the history. So we are some history loving people, and when oftentimes people often ask me, well, why are Black women dying, or why are Black women experiencing experiences, and I'm just like, well, let's take it back to Dr. Marion Sims, right? So Dr. Marion Sims, he is considered the godfather or the father of gynecology and obstetrics. And this man is known as he was a sadist, and he used to perform surgeries and experiments on Black female enslaved. So I tell people, if this is what the foundation of gynecology and obstetrics is in America, that this industry, this faction of the healthcare system was literally birthed on the mistreatment and the exploitation of Black women. To me, it's not surprising that Black women I tend to have the worst outcomes, because that is in the fabric. It's in the fabric of gynecology and obstetrics. So we're asking, what does it look like if medical schools moved away from that model? What does it look like if people who aspire to be obstetricians and gynecologists understand where the history and what they need to change and move away from? And so I think that for us, we love to name a thing. And a lot of times people say, oh, well, race is the risk factor. No, race is not the risk factor. It is racism that's the risk factor. It's how you treat me when I come to your doctor's appointment. It's how you treat me when I say I don't actually want to do that, and trust that I'm not just uneducated, but I'm making an informed decision. So that's what I love about this work, is because I'm like, our granny midwives, they caught babies in the South, in the house, and the infant mortality rate was better when granny midwives were doing this out of the hospital than it is now currently, when most of birth happens in the hospital. So to me, I'm like, what does that speak to? That speaks to the change of the social infrastructure, where our communities relied on each other. They use their herbs, they use their tradition, they use spirituality, and how birth got moved to the hospitals, and we got stripped of those things that have traditionally have supported us. So I'm glad you asked that question. So when people say, oh, well, my doctor is nice, and I'm like, your doctor may be nice, but what is the training that has led them to violate your human rights? Because a lot of it, you become complicit, because if you don't question what you're being taught, you're not questioning whether or not this is the most humane way to do things. And so I love one of the things Asteir says is that your doctor might be a nice, well-meaning person, but the model is the model that they are not working in is not humane. If it's not collaborative, then it's an injustice for our community.
Asteir, you two things I know that we want to get to, and one of them is, so why just African women of African descent, and indigenous women or birthing people? Why just those folks?
So I think we kind of talked about that. We named it. Sequoia just named it. But
Okay.
I think that I think, like I said, I think birth is personal, and we know that historically, African people of African descent and indigenous people also, we know that they have been left out of humane treatment around reproductive health care. And so we also know that we need spaces of healing and restoration without a gaze, without people um, um, without feeling like we can't share the harm and the injustice because other people are watching. And so it is important that we have these spaces, and it is important that we have a people of African descent and a Black identifying doula training that is just for us, because so much of our work around birth, particularly, is around healing. It is around moving forward after so much, after generations of not being heard, and then moving forward together in a self-determined way. So, I think it's important to name that. I also know that there are lots of doulas from other communities doing work. But, when we talk about childbirth, we need our own people to honor the traditions of of wherever we're coming from. So we have doulas from the Congo and Somalia and Sudan. And so I could not begin to, step into that role, because that's not, I didn't come from there. I didn't come from those traditions. Birth work is sacred work. And so those women who are serving their own community are particularly um, experienced and have the expertise to serve their own people. So I think that's what we're talking about.
And I do appreciate that. We're talking with Asteir Bay and Sequoia Kemp. They're from the Sankofa Reproductive Health and Healing Center. And before we go, the healing piece of this work, talk to me about that. And then what your future looks like. What are the things that that you're aspiring towards, that this grant has propelled you into, for example?
Mm-hmm. I think that when we think of, we just have these conversations, and we're always dreaming. Every founders meeting where we're just trying to plan for the month, we always end up planning for the year, and because there's just so many things that we want to do. But I think as far as the healing, we offer it's called co-mothering, a Black mother's healing space, where we believe that like postpartum is forever. So whether you've had a baby 6 weeks ago, whether you had a baby 4 weeks ago, or 20 years ago, there is still an opportunity to find healing, to make peace with whatever you may have experienced, or maybe not make peace with how you were treated, but finding a way to cope so that you can find some type of freedom. And so I think for that, again, Black women being afforded the space to be vulnerable, not to be in a space where you don't have to be strong if you don't feel strong, and know that you can do that and be held. I think that that's something that we need more spaces like that. And then when you get down, breaking down, we rise up, and you feel more powerful because you were allowed to actually lean in to the things that have hurt you, so that you can actually appreciate and experience joy. And so for us, I think that it looks like us being able to continue to train more community-based doulas under the philosophy that we have been training under. I think it looks like us, really having being able to offer our services to those in our community. We offer yoga for reproductive wellness, prenatal yoga, childbirth education, doula care, and reproductive counseling. Just being able to continue to let folks know that we are here. And eventually we would like to have a easy access clinic where the people can come and just be like, you know what, I got diagnosed with fibroids. I don't know what to do. Okay, let's sit down. Let's talk about what your health history is. Let's talk about your your family history. Let's talk about what your diet is. Being able to have these conversations again in a way that's not shaming people. And we just want Black women or people who are Black, Latinx, Indigenous to come in this space and say, here's what I'm dealing with, and I need support, and finding a way to support in the ways that are within our scope of practice. And so I think that, and I'm an aspiring midwife, and so is Asteir. So, you know, down the line, we do hope to be able to provide this community-based, easy access midwifery care. But right now, we're focused on wellness because we need it.
What's the difference between midwifery and doula?
So, go ahead.
So a midwife is the medical provider.
Okay.
And the doula is the non-medical provider.
You did say that earlier, so I should have caught that, but thank you for that.
Mm-hmm.
So with that, did you share what your goals are for the future?
Is there any more you want to add, Asteir?
No, I mean, I think, you know, the Sankofa Reproductive Healing Center is really honored to be called a perinatal safe spot. And that is from our mentor and our midwife, Jenny Joseph. She's a midwife in Florida who has a national perinatal task force that we are lucky to be a part of, where community-based organizations like Sankofa all over the country, who are Black women-led, who are actually doing this same kind of work. And a perinatal safe spot is a designation chosen by Mama Jenny, who we affectionately call her, as a place where she knows that we are upholding the standards of a task force, and we are creating safe and sacred, dignified care around reproductive justice. And so it truly is an honor to be amongst the people who can call themselves a safe spot. And so safe spots across the country look exactly like what we look like, but they also look like wellness clinics. They look like birth centers. They look like community co-ops for midwifery care. And so there's a whole range of things that we can choose from. And so this grant from the Equity Grant has really put us in a place where we are able to build a foundation for whatever we can grow into. And a lot of that has to do with, you know, how the collective moves, but there's so many possibilities. And we just hope that the equity community and other funders can kind of see the necessity and the need for this work, and then we can continue to build from it.
Mm-hmm.
Asteir Bey, Sequoia, Kemp, how do people get a hold of you all?
So we, you can reach us at communitycares@sankofaheals.com. We also are on Facebook. So if you look up Sankofa Reproductive Health and Healing Center, you can find our page, like us, follow us, DM us. We're also on Instagram at Sankofa Heals. And on there, you can find our number. I can look it up for you 1 second.
315-920-2787.
315-920-2787. Did I get it right?
That is correct, yes.
315-920. Say it again.
2787.
2787. Sequoia Kemp and Asteir Bey, co-founders of the Sankofa Healing and Reproductive Health Center. And we love the work that you're doing. Thank you for the work you're doing. Building our community, right? It's the work that has to be done. And this is what the most critical part of our work, right? Because we've got to protect our women, and we have to protect our children and our families. So we thank you, and we appreciate you. Inspiration for the Nation.